everybody, welcome back to another episode. This is the fourth episode, and today we have a different kind of person who is in a field which I really respect, which is the medicine field. And we're going to speak about urology and a lot of things related to the health of men and kidneys and everything. So we have Mohammed Tariq, who is the special doctor who has been working with Saptagiri Institute of Hospitals. And so welcome Tariq. How do you feel?
Thank you. I feel good.
So Tariq, just let us know, like, what is this urology field in the first place? As in, we know a lot of medicinal fields are there. In that, the specialization, why is it special? And what is if without this, what would happen in the world? Why is it important to be there?
Urology is a branch of medicine that deals with diseases of the kidney, ureter, bladder, and basically the male and female genital urinary tract. So basically, if you have any problem with peeing, you don't pee or you pee too much at night and you can't father a child, you come to a urologist.
Interesting. So it does deal with a sensitive topic, as in we know human body is very complex and each and every organ is important, and urology deals with one of the very
important organs.
Important organs. And it is also in one sense, we can say, for a common man, it is considered a bit of taboo, or people who don't want to read would not choose it readily. So I'm very curious to know that after your specialization, or when you had to choose this as your career, what made you choose it?
I think for most doctors, once they pass that first year and second year phase where they study anatomy, they get through all these, they just basically get through all of this. Mm-hmm. And I don't think it's considered a taboo in our field. Maybe the common man probably sees it that way. But
so you had basically no inhibition at all when you had.
I for one did not have any inhibition. Both my parents are doctors, so okay. I mean, I was used to all of these things from a pretty young age. So blood, I can take it. Urine, I can take it.
No, it's actually it's quite a big deal, because here when we see there are some humans who don't even try to enter a hospital. They try to avoid it as much as possible because it kind of puts a mental toll on them to see other patients or other people suffering.
Yeah.
And for a doctor who is invariably has to go through it every day, would like to know what kind of mental it takes a part of you as well, isn't it? So can you speak about how you manage that and the work-life balance also?
So I think it's just a state of mind. You have to be strong in your field. There are times where you feel, what am I doing? What's happening to the patient? Patient's not going to come out of this. It's difficult, but it's just a state of mind. If you are strong mentally, you can come out of it. I mean, you just have to keep moving on. That's it. Mm-hmm. Like you're moving.
Okay. So I mean, So
that's not to say that we don't need breaks. We do need breaks. All doctors, there is burnout. People do get burnt out. So everyone needs a break.
How stressful is it? I mean, what could be the number of hours you go without sleep, or something like?
So every third or fourth day, when I was back in my when I was studying, every third or fourth day I had night duty, night calls. But urology, as such, all emergencies can be managed by diversion of the urine, or whatever means. So it's not very difficult. Maybe other fields are a little more difficult. Takes a toll on your sleep, on your lifestyle. Urology, I mean, it is, but we didn't have that much of a difficulty.
Okay, so when you're off duty, do you get emergency cases? And
we do get phone calls. Okay. We manage them on the phone, or we manage them if you have to go and see the case. We go see the case.
So, okay, so mostly
it's not very difficult.
Okay. So these kind
if you know what you're doing, sorry.
So these emergency cases, what kind of is it like? Mostly, what would it be? What kind of patients do you, or what would be the reason for them to come in most of the time?
Okay, so most of the times patients come to us, at least in our hospital, with pain, abdomen, pain in the flanks, pain radiating down in their lower abdomen. So basically, colicky pain, where they have a stone in their. Some of them are not able to pass urine, so we have to catheterize them, if we can, or divert in whatever way we can.
So these are priority cases, isn't it? Because someone
if
who's
he's
not able to.
if he's not able to pass urine, or he has severe pain, that's a priority. It's an emergency for us. But that's not to say that we don't get other kind of emergencies in urology. We do deal with them as well. Yeah.
Okay. Yeah. So we were talking about kidney stones, and I know that it's a very common thing for humans or men in general. So there are so many treatments, and first of all, like, what would be the reason why someone would get these kidney stones? Is it something that can be avoided in the first place?
Okay. So kidney stones, they occur in about 20 lakh people in a year in India. About 1 in 8 or 1 in 8 adults will develop a kidney stone. It's more common in men than in women, but the gender gap is, like I said, narrowing.
Okay.
As to why it occurs, there's a lot of, it's multifactorial. There are a lot of causes: genetics, lifestyle, your intake of water. It's a lot. There are a lot of causes that can cause kidney stones.
So this is basically a stone, right? Like if I just recollect the diagram from our school time, kidneys, and then you have that the urinary line. I mean
ureter,
you call it, and then the bladder and the other genitals.
Yeah.
So here any part of that urethra or the kidney, the stone can form by itself, isn't it?
Ureter, yeah. So
Okay.
the kidney, what happens with there's usually a stone in the kidney, and that usually passes off into the ureter and eventually into the bladder. So what happens when it passes into the ureter, it can get stuck at certain places where there's narrowing, and the body has a habit tries to pass it off. So you have waves of that colicky pain that you get, and depending on where it is, it can radiate to a particular area of your body.
Wow, it's painful as I hear about it.
It's very painful. It's severely painful. I mean, it's very painful.
So does it also cause bleeding in that case, internal bleeding?
Yes, so it can cause some sort of some amount of bleeding that you pass off in your urine. So it can cause.
So I assume that kidney stones is actually occurring to people invariably, and then depending on the size of it, it can get stuck in the urethra. If it is a small one, maybe it just passes it. So if it's a big one, like that's when you kind of do all your procedures wherein you blast it or remove it through a surgery, isn't it? Like
yeah.
okay.
Yeah. So depending on where it's located, what is its size and what is its hardness, we can do either one of if it's in the ureter, we can go from below endoscopically via the natural tract, and we can put a scope, either rigid or semi. We can put a rigid scope and try to blast it and remove it. If it's in the kidney, it's a large size, more than 2 centimeters, for example, then we can also do another procedure. It's called PCNL, percutaneous nephrolithotomy. So we make a small hole through in the back, and then we dilate that tract, and then put a scope there and try to fragment it and remove it.
Okay.
If it is, if the people don't want invasive procedures, and if it's of a particular size and particular hardness, less than probably 1,000 ounce feet. I mean, that's not relevant, but
Okay.
if it is not that hard, then we can also try to do shockwave lithotripsy, where they use sound waves and they try to fragment the stones.
Okay.
And you pass it normally. Sometimes might be painful.
Wow. So I mean, it's not something that would spread. But then, so how long does this procedure take for someone? If I'm on pain now, and I come to the clinic, and how long will be the timeline for the diagnosis and until the pain I'm relieved out of it?
So when you come with pain, the first priority of a doctor is to relieve your pain.
Yeah.
So we first give medicines or injections to relieve your pain. That's the first priority. If they don't, go to the hospital, get a pain injection. then generally, depending on how we plan to investigate you, we generally, for a stone, we probably do a CT scan with no contrast. And then we see the size of the stone, how hard it is, where is it located, how far is it from, our puncture sector, which is the kidney. If it's in the ureter, what is its size? Based on that, we decide what further plan of management. So anywhere, if you get admitted with pain, first we relieve your pain, and within say 1 hour, the CT scan is done.
Okay.
And after that, depends on when we planning for it. If you plan for it.
Interesting. So yeah, that's interesting actually. So yeah, apart from the pain, I just want to move the conversation a little bit away from the pain because it's kind of hitting me as well. So there are certain things, as in when we talk about urology, another main component of it is there's nothing to be very shy about it, but it's a general thing. Everyone goes through it. It's the sexuality of people, and prostate is one of the main organs which takes care of it. And of late, there are we speak about a lot of cancer-related stuff that is happening.
Yeah.
So basically, cancer is nothing but a mutated growth of a cell, right?
So basically, it's an uncontrolled growth which your body cannot get rid of.
Okay.
It doesn't stop growing, keeps growing.
Okay. And it spreads like mad.
Yeah, it spreads. Yeah.
Yeah. So it could happen anywhere in the organ. So testicular cancers are very prominent, and your prostate cancer is prominent. Right now, having the technology where it is it something which can be treated? And if I know there are different stages of or size of the cancer that can be in a human. So at what level can it be? It's negligible.
Okay. So prostate cancer as such is generally a disease of the old age. That's not to say familial forms cannot occur in people who are 40s and 50s. So depending on the stage that the patient presents to you, all forms of cancers are treatable. The early stages that are localized are curable, but the metastatic ones, the advanced stages, they are treatable with chemotherapy.
Okay.
But
so how do you define this advanced stage? It's basically the size of the cancer, right?
Prostate is actually it's not a very large gland.
Okay.
It's a small gland, but the tumor can be aggressive. And if the tumor is aggressive, it can spread. And when it spreads to the lymph nodes, or it spreads to your bones, in the back. So it's very common with prostate cancer. It can spread to the liver also. These are called metastases. So it can spread somewhere else to away from your organ. And once it reaches these stages, the advanced stages, chemotherapy is it's called triple therapy with treatment intensification if the patient is able to take it.
So for a general human, right? They if they have to ensure that they don't get, they're safe. So there are not much symptoms apparently, isn't it? For any sort of cancer, sometimes you detect it yourself, you feel it in you at a very later stage. So how do we ensure that we are at a zone health checkups or any sort of advice that you would be able to give for
with respect to prostate cancer or with respect to general?
So no, mainly for the cancer part I'm asking right now.
So prostate cancer is generally, like I said, a disease after probably 50 years, 60 years, it depends. So usually patients present to us with some symptoms in the lower urinary tract, right? So when they present to us with these symptoms in the lower urinary tract, we generally do an examination and we find out maybe there might be a enlarged, if at all we feel an enlarged nodule in the prostate. Or we do a prostate specific antigen, a blood test. And based on these, we figure out what is happening with me. Now, if they are elevated or there is something wrong with that, then we can do a biopsy. When we do a prostate biopsy, we get to know what is happening with the patient. And based on that, we risk stratify them into particular categories. And again, based on that, we do particular imaging.
Okay.
And from there, we move on further.
Nice. So, what is the equivalent of a prostate cancer for women? Does a urologist again specialize in a female urological field, or how is it?
So, urology as such is to deal with generally women don't have a prostate.
That's right. Yeah.
So for their equivalent, they usually go to an obstetrician. They have disorders of the ovary, disorders of the uterus. So they generally go to an obstetrician.
So that's a different study altogether.
Generally, that's a different specialty.
Okay.
So obstetrics and gynecology is different from urology.
Okay.
And we urologists are separate from nephrologists.
What is that?
Urology is we basically do medical and surgical disease of the kidney. So we operate on the patient. Whereas nephrologists, they have only medical disease of the kidney. So they don't operate.
Okay.
So they are not surgeons.
Okay, so they're more can we say they're more theoretical and or was it?
I mean, yeah.
Okay. Okay. So yeah, since we were talking about
You're
prostate,
gonna get a lot of backlash from nephrologists.
no, we'll ensure that doesn't happen. So how do we ensure that like for the men out there, what kind of diet and what kind of activities should they be involved? Because everybody likes to be high tested. It gives you that. Not only, I mean, testosterone is there in women as well, isn't it? A part of a small
Maybe a
portion
little
of it.
bit,
Yeah.
but not
Yeah.
not large much. Unless he has, unless it's a he and not.
Okay, so that's the question basically. How to ensure that you're healthy in that way, and then you have a high sperm count and healthy one.
Okay, alright. So to maintain your testosterone levels, generally a good sleep of 6 to 8 hours in a day or at night, and the quality of sleep is also important, right? So good sleep, 6 to 8 hours at night is sufficient. At the same time, that combined with exercise, not very severe, intense, vigorous exercise, that will actually reduce testosterone level. But like lower body exercise.
Wow, is that so? Why is that? I mean, I use
exercise and testosterone level. There's a correlation.
Okay.
It's not. We have not. I mean, there is a correlation. It doesn't mean that it should always happen. But generally, patients or people who exercise, specifically of their lower body, of a moderate intensity, that's called resistant exercise. So if they do that, generally they boost your testosterone levels.
Okay.
And apart from that, your diet as well. So you're supposed to eat a lot of fruits and vegetables, medium amount of fat, try to avoid processed food, and try to avoid drinking from probably plastic bottles.
Right.
Yeah, there's a lot of study now on microplastics and the level of your concentration of your sperms. Yeah.
So this there are a lot of myths, right? When we're speaking about exercises and things. So we are also saying too much of anything is not good, and you keep your exercises, you do it at moderate frequency to have a healthy thing. So there are so many myths about these mass gainers and your even for that matter. When women there are some myths which says women go to the gym, they get that testosterone level and they might feel more manly and things. How much of this is myth and how much of it is like we have to be really careful?
Well, you got to see what these mass gainers are actually giving you. So most of them have some amount of amino acids that are essential for your muscle buildup after micro tears. So you got to see what they're giving you. Is it FDA approved or not? Most of these mass gainers are not FDA approved. So most of them eventually do give you they usually combine some amount of amino acids, some amount of carbohydrates, or some sort of a drink, and that you mix that with with water and plenty of liquids every day to increase the muscle mass. As such, they don't give you testosterone. I mean, I don't think they give you testosterone in the powders.
Okay.
I don't think they're allowed to.
But we can say it is not correlated, right? I mean, kidney stones, or is it because if you don't drink a lot of water, then it's a problem?
So if you don't drink a lot of water, you end up, having forming stones. You have to take a lot of water when you take these mass gainers.
Scientifically, why is that? Is it because of the amino acids build-up that you are talking about?
Because of what you are taking in,
Okay.
and it's not getting washed up. So yeah, you have to take a lot of water when you're taking all these supplements.
Okay, interesting. So I mean, just a little bit of a fun question, right? They say that we have two kidneys and God has given it to us so that if one doesn't work, and you can use the other one for any sort of trading or like investors. I know you're also an investor, so sometimes there are. I mean, that's the fun part of it. But then there are serious cases where they do kidney trafficking, kidney transplantation, all that, right? So I know that we are very careful in those cases, but is it really something that you can live with one kidney? Because even that is in danger. Your reserve is also in danger.
You can live with one healthy kidney.
Okay.
Like you normally live. You don't need to have two kidneys. I mean, having two is better than one. Okay, but one you can live a healthy life.
Okay.
One normal kidney. You can live a healthy life.
So this, I mean, alcohol, and everybody knows this. Alcohol and cigarettes are bad for your health. It's bad for anything organs related. Everything, it has unimaginable effects. But we still follow it. And most of the kidney and livers are the main organs that get affected, right? When people consume a lot of alcohol. So, I mean, what advice would you give to people to not do it?
This is, I have to answer it differently.
Okay.
So, in one way, there are studies that prove that, and they've not proven it.
Okay.
There's no randomized controlled trial that they have done till now, but they have found correlation between some agree with it, some don't agree with it. When you have kidney stones, you can take some amount of alcohol, specifically beer or wine, that is red or white, or some sort of citrus fruits,
Wow.
Juices.
That's counterintuitive, isn't it? I mean,
Yeah,
okay.
so that actually helps you probably pass your stone if at all it's formed.
Okay.
More than anything, but you need to avoid your Pepsi and Coke, those sweetened beverages. You should avoid that. On the other hand, taking a large amount of alcohol can suppress your it can cause erectile dysfunction.
Okay.
So it can deal, not anything in too much. Anything that's too much should be avoided.
Okay. That's not on.
Everything in moderation is alright. Whereas smoking, on the other hand, it's strict. Stay away from it.
Yeah.
There's nothing good that comes out of it.
Okay. Even drinking is a little fine, you're saying, but smoking is
Drinking
not.
like 1 volume or 2 volumes.
Yeah, so we're not promoting. I mean, the doctor is not promoting it for sure. But yeah, that makes sense because you're consuming more water. Basically, that's what is the.
Yeah, and it causes diuresis to prevent your stone formation.
Okay.
So, yeah, and of course, if performance anxiety, you can, it's sort of an anxiolytic at times.
Right.
If you know what I mean.
Yes, of course. So we were speaking about that leads me to the erectile dysfunction topic which you are speaking about. I mean, again, it's a very they're all adults, so we know how it is, and sometimes people do struggle with it. So again, there are so many things like lifestyle, your work, your stress, and your not lack of sleep and everything. So what kind of diagnosis do you do, or rather, like how do you actually treat it? Basically, it's again increasing the sperm count in the body, or what is it?
So erectile dysfunction, the prevalence is around some say about 20%, some say about 50%, right? It keeps increasing with age. Yeah, like the causes you've all labeled out, all of them are true. So how we generally have a conversation with the patient regarding what is happening, and try to find out what is the stressor that is causing this. If it's correctable, we treat them with, we counsel them and treat them with a medicine.
But it's mostly stress, is it? It's not something which is like physical, something else?
Okay, so it could be also drugs that they're taking. Suppose the patient is a hypertensive, he's taking an antihypertensive medication. We see what kind of medication it is, whether we can change that into some other medication that does not cause hypertension. Now, if it is stress, it's some interpersonal issues that the patient is having with his partner.
Right.
Or, so we have to assess the situation and then treat accordingly. But it is treatable, yes.
Yeah. So yeah, you were saying about the kidney stones, right? So the prevention, what is the remedy for it? Like, I mean, what kind of treatments can happen for that?
Okay, so generally, we advise all patients, whatever size of stone they have, once we have treated it or we have not treated because it's too small, to take a lot of water. So for example, say they take about 2.5 liters of water in a day, so that they pass at least 2 liters of urine throughout the day. That is a simple thing that we can, advise. Second thing is we tell them to try to reduce the salt intake in their diet. So, to reduce the salt intake, but take a normal amount of, calcium that they are normally taking. It's not necessary that, you have to reduce the calcium intake because you have some form of calcium stone. The calcium intake should be normal, whatever you were taking, 1 gram or 1.2 grams per day.
So milk, right? I mean, calcium.
Yeah, whatever form of calcium that you can take, it should be normal. You should not reduce it because you have a calcium stone. So, yeah. Drink a lot of water, reduce your salt, take a normal amount of calcium. And depending on what kind of stone, the medical management can, be different form of drugs.
Okay, so that's about the kidney stones. Now there are like other issues also people go through, right? Like when I, as a teenager, we all had something which was very strange for us in the beginning, at least as men. It's just something called the morning wood. So this is something which is very common, isn't it? I mean, should someone get scared? Teenagers say, when they go through it for the first time. Why does it happen? Is it general natural phenomenon?
Yeah, so for teenagers to have this condition, it is normal. If they don't have it, then that's abnormal.
That's when they come to a urologist.
I mean, they come to a urologist when they have it as well, and when they don't have it as well. Yeah. So they're worried when they have it, or their parents are worried, or their friends are worried.
From No Shave November is where No Nut November also that challenge started. So does it actually help anyone? And is it actually benefiting?
No, it doesn't help you in any way. There's no such study that says it helps you. Don't torture yourself.
So it's basically just only for the sake of self-control people do it, isn't it?
Yeah, but it doesn't help you in any way.
Okay, scientifically nothing.
Scientifically, no.
Okay, so even too much, I'll be open in this. In too much masturbation, I mean, masturbation itself is, some people treat it like it has to be done so that this thing gets replenished or whatever.
That is normal as long as it doesn't affect your, your daily life activity that you do. You go to work, you're not going to work, you're only, if it affects you there, then it's a problem. If it doesn't affect you, it's normal for all men and women,
So business aspect of things, right?
Yeah.
The doctors basically they have multiple avenues in which they can work once they pass out, right? Like once they get into the specialization. So basically you can go to a hospital, be a consultant, or open your own clinic. So what are the differences in all of that? What would someone suggest?
So what I generally feel is if you find a good mentor,
yeah,
you have to follow him. Suppose he does all different kinds of surgeries. It's always good to shadow him, to follow him, so that you learn as you grow. So that usually happens in a hospital setup, right? And if that hospital setup is a medical college or a private hospital, and that allows you to also have a clinic, as a side, a setup on the side. So you have benefit of both, You can get your tough cases that you want to operate, you need help with at the hospital where your mentor is, and all the small cases that you can do on your own after your training, you can probably do it at your clinic. But don't hesitate to call for help whenever something goes wrong. It's not that it's not uncommon. Mishap happens. It can happen to anyone, but you should be you should know when to call your senior.
Okay. So you were saying we need some special permissions for opening a clinic. So if you being a doctor, you have to. What will be the criteria for a hospital to let you do it?
To work in the hospital?
To have a separate clinic.
So that depends on the hospital policy. Different medical colleges, suppose you are working as a full-time, employee there, they don't let you have a private, clinic.
Okay.
Whereas some hospitals do allow. It's just a policy decision.
Okay. So how is the money aspect of people who are in a hospital? Do they get paid well, or we know it's a long journey, right, for someone to get into this?
Yeah. So you do 4.5 years of studying in your MBBS, and then 1 year of compulsory rotatory internship wherever you do it, and then you study your NEET exam with all the scandals to become broad specialty, and then after broad specialty, now that everything is very compartmentalized, you have to do super specialty if you want to. That's another 3 years. So 3 plus 3, 6, 6 plus 5.5 is almost 11.5, and 1 or 2 years that you drop. That's around 13, 15 years. So by the time you are finished with your studies, you are well over your 30s. So after that, if you have a good mentor, then you can proceed from that. So generally, when it comes to the pay aspect, when you're doing your, just stick with super specialization. In Karnataka, we have a a standard policy where all postgraduates in super specialty in their first, second, and third year are supposed to get 55, 60, and 65,000 rupees per month compulsory. But generally, what private colleges do is they transfer that to your bank account, and some students have to return it under the table in cash. Otherwise, they don't let you write your exams. This is a very common practice that happens from private medical colleges.
Okay. So
then post that, if once you get into suppose you join a government hospital, your pay can start from 2 lakhs per month and upwards. Private colleges may pay you more or may pay you less depending on what is the patient load that they have.
Okay. So I mean, it is you're sacrificing the general outlook for people is that doctors get paid well, they don't have to worry about it. But then they have to go through this in the beginning, initial stages. They have to start because you're not getting the ideally the 7 years or 9 years you were speaking about. There's no income at all, right? You have to be dependent on your own family or something like that.
Yeah. So the first 4 years of your 4.5 years of MBBS, you are not paid anything. In your internship, you are paid a certain amount. It keeps changing. The amount you're supposed to receive from the college or the hospital keeps changing. Depending on I don't remember how much it was the last time. In your broad specialty, you get paid around same 55, 60, 65. In your super specialty, you get paid 65, 55, 60, 65 again.
Okay.
So that's the only stipend amount that you get during your studying period. Post that, it's your private practice and your hospital, whatever they pay.
So having a clinic is definitely an advantage, isn't it? There's extra source of income for a doctor if someone is thinking about it.
If the hospital allows you, having a private setup for yourself where you can get your patients, the tough ones, you can take them to the hospital where you might need help.
What do you mean tough ones?
Like the ones that you are not very good at performing, but you started. So generally when you start off, there is a learning curve.
Right.
So when you might need help somewhere. So it's always good to do it in a setup where there's already help, where someone can help you when something goes wrong immediately.
Okay. So basically.
But doctors generally, as they grow older, they get more wealthier. Yeah.
So they have to bite their teeth for some.
Yeah. Initially, overworked, underpaid, but later, I think.
Because when you're having a clinic separately, and you're gonna, in fact, it's not your money is gonna come, but you also have to work that many hours because your even though the policies of your hospital, your core hospital, allows you to do it, they're not gonna sacrifice on the number of hours you come in, and in case there's a patient or an emergency case, you're gonna rush up from the clinic into the hospital. So you're putting in more man hours to get that extra money, isn't it? That's the
So it is a process. We have it is stressful initially. Especially when you are learning, but when you get better at it, it becomes a little easier. And when you have help and support from your professors, your teachers, your colleagues, it's even more easier. So you can rely on them if something goes wrong. But all that is very rare in a hospital setup.
So how will life be in an institute as such? You're going to get patients, maybe from the patient's point of view, they are getting feed lesser, right? As in, when you compare them going to a private hospital, they would prefer coming here.
Yeah. So generally, it's the hospital that you have and what insurance policies or what insurances that they are empaneled with. Those BPL patients, below poverty line patients that come to you, generally have something called an ABARK, card with them, and generally they have a list, a number of surgeries and the amount that's sanctioned by the government. They come with a letter from their taluka hospital and
recommendation.
Basically they have this problem and we can operate on them with these insurance, with that insurance. Depending on private insurance that are empaneled in the hospital, they are also, they also come and they probably take different wards, according to their category. So all kinds of patients come to you, from ABRK to ESI insurance to CGHS to ABRK.
Okay.
And private insurance.
Wow.
So they all come.
Okay, since you touched upon the insurance topic, right? So basically, how is it insurance as such in India? Right? Do you feel that patients who are coming or having the required money to have, put in whatever is required, or is it like they are dependent on insurance, and how different is it in abroad?
Depending on the area, depending on the area. So there are patients who can afford, who have, illegally got these cards, ABRK cards,
Okay.
and they come to the hospital, even though they can afford it. That's just government policy and government officers who gives it to them. But yes, generally patients who get these ABRK cards are very poor.
Okay.
They are not able to afford, any extra charges that the hospital might, add to their bills. So ABRK generally patients are very poor. ESI is covered by the state scheme, which is similar to CGHS, Central Government Health Scheme of India.
Okay.
So they're all covered under, most of their treatment, aspects are covered under these insurance coverage.
So you feel that insurance is actually a lot available. People have taken it up seriously in India, or health insurance is something which, as a doctor, you would also recommend people to have?
Absolutely. Everybody should have some form of health insurance. You never know when it might come in handy. If there is ABRK, that's for people with below poverty line. There's another one with above poverty line, where they get a certain amount of money from the government. And there is ESIC, which is completely covered by the government. Certain treatments. There is not every kind of treatment. And private insurance. So generally what happens is there is private insurance is not, people do, buy private insurances, health insurances, but certain sects of, our community, they generally try to avoid buying health insurance because it's, it's a taboo. It's in their religion, they're not supposed to buy any insurance. But I'd recommend everyone to have health insurance, especially now that everything's getting more expensive. You never know how expensive a treatment might be. You never know what diagnosis, what problem you might have in the future. So it's always advisable. It is advisable for everyone to have health insurance.
So where are we standing in terms of when we say healthcare is getting expensive? Say we know that abroad, and especially in America, the healthcare system there is advanced, and you could also explain a bit about what is the difference between Indian healthcare and theirs, and also the insurance. The people have taken it more seriously, or it's even more expensive, right? In fact, we also notice some of the celebrities or politicians they prefer to go abroad to get it treated. So what is the common reasons for that?
So abroad and India, the US, the treatment is more or less the same. What is the standard of care is usually, performed here is performed there. It's just everything is more expensive there, from getting admitted to getting consulted by a primary care physician to getting transferred to a super specialty doctor, to finding an appointment, to getting drugs, to getting investigated, to getting treated, and the entire hospital process, the bill. Every step is very expensive and very difficult. I won't say difficult. I think it's more complex there. In India, it's cheaper. It's more easily available. It's easier here. Whereas in terms of the kind of surgeries that they do, it's more or less the same. The only thing that we lack in is research.
Okay.
So they have more funds. They have more, research scientists and activities that they perform. Not so much in India, but we are still getting there. So more or less the same. It's more cleaner there in the hospital. But if you go to private hospitals here, they are also very, very clean, but the bill is a little higher. So that's where your private insurance might help you. Suppose you want to go to a very top-end hospital and you get a small surgery done or a surgery done. The bill can cost upwards of 20 lakhs.
Wow.
Depending on the kind of surgery, maybe even more. If you're admitted to the ICU, even more. So it all depends. If you have private insurance, they do cover a certain amount of the bill. So that helps you.
Okay.
So private insurance, hospital insurance, any form of health insurance is a must.
When we are talking about US healthcare in here, what would be? I mean, I know it's difficult to put some data on it or start. We don't have it handy, but roughly, like how much of a success ratio is there? Someone getting treated there, someone getting treated here, especially in your field.
In urology,
Yeah.
I think we have the best doctors in India. Some of the best surgeons in the US are Indians. They have migrated there, but they are Indian, and they are even in the annual meets that we go through. Even they are only, most of them are Indians. So the best doctors, best surgeons are from India, and we have a lot of them in India. So there is actually no need to go to the US for any form of treatment, at least in terms of urology. Maybe the more advanced treatments that are there that may be covered, that are not available in India, only those probably. But even then, how effective are they is yet to be seen.
Okay. What are these advanced? I mean,
so for example, bladder cancer. There are newer drugs that are available for bladder cancer that are available in the US. But are they really effective? And they're not available in India. But they're not really that effective.
Okay.
As compared to what standard of care that we have. So it's not really that, like I said, they are more into research, they are more into finding newer alternatives or alternatives to, what is the standard of care.
Okay. So Tariq, about little bit about the doctors, like, right? I mean, we when the patients are there and there's some surgery going on, the emotions are really high, and we also have seen in past, the only person who the doctors are also seen as gods. At the same time, if people also get angry on them if something doesn't go right. So we all know you all put the best effort, and whatever you could. What kind of emotions that you have seen, or like what do you feel about that when patients don't get it in the right sense with you all?
So I personally have not faced any, but I do hear, and there are a lot of instances that I find that usually what happens is in the emergency department, and when a patient is brought to the hospital, is probably brought dead. Emotions are running high, like you said. The family members and the attenders who brought the patient, they want you to do something when you can't do anything. It's usually at these times that doctors end up getting beaten up. So
blamed or
beaten up. Yeah, and it's unfortunate. Our laws are there to protect against these violent acts. That's pretty much. I have not personally faced any as such, but yeah, it can happen.
Okay. So any instance where you had gone through a difficult surgery, which, like you said, was like seeming very impossible, but at the same time, you all were able to put it together and make it a success. So any sample story from the?
Yeah, I give you a recent one that I remember. Where I work, we were trying to do a laparoscopic simple nephrectomy. We put the camera port and we put the working ports in the abdomen, and then we realized that we were trying to find the right plane to to go at, but we absolutely struggled. We were not able to find the right plane. We thought we were going to convert this laparoscopic surgery into an open surgery, and this was just a simple laparoscopic nephrectomy.
Okay, just a bit of definition of what is that?
So we're trying to remove the kidney, and it's just a simple nephrectomy. We are not going, outside a particular layer. This is a simple nephrectomy. We're just trying to remove the kidney inside the particular, inside the kidney, inside the gerot. It's called the gerotous fascia, not outside. So we were struggling with the planes. Then luckily we had our boss who came in and immediately helped us, and we labeled that as he finished the surgery in about 40 minutes. Nothing happened. Patient was fine, went home. Came back for follow-up, absolutely fine. So laparoscopic simple nephrectomy is not very simple. So we had termed that case as a legendary laparoscopic nephrectomy.
Wow.
Okay. So yeah, so there is different levels of simple nephrectomy as well in our in our dictionary.
Must have been tense, no? Those moments.
Yeah. So when we were
How many hours was it?
it was about 1 hour 45 minutes, but we ended up doing it laparoscopically. We did not open, convert into an open surgery.
So open surgery meaning you cut the body and then
Yeah.
get the
So
organ.
there's a large scar in your,
Okay.
in your flanks.
And that is more complicated.
Yeah, because of the large scar.
Okay. Nice. So Tariq, what kind of advices or for the upcoming urologists, can you just suggest the path that is ahead for them if they want to choose this as a career, the struggles that are there, what does it take for them to reach a stage where you are right now as a senior? Yeah.
So from where I come from, both my parents being doctors, by default I was already going to become a doctor, and I became a doctor.
Okay.
How I took general surgery was thanks to Ahmed, a friend of mine and yours. He and I ended up taking general surgery, and the funny part is I continued and he left. He's in his own field right now. So I took up urology because I actually liked it. I wanted to explore science. I wanted to help people, and plus my mom being an obstetrician, I wanted to be something
Competing?
something close to her field,
Okay.
but not in her field.
Right.
So I want to take up andrology beyond this. I can't take up obstetrics and gynecology. I mean, I can, but that is that field is dominated, not that field, that branch is dominated by women, whereas this branch is dominated by men. That's not to say we have anything against women in our branch. It's a little more difficult for them, to compete with this. You should only take this field if you are, if you're interested, if you are passionate about it. If you are not, try doing something else.
Okay, as simple as
Because
that.
this is a very long process. 11.5 years. By the time you get older, sometimes doesn't pay you that well unless you go abroad. Even then, you can make a lot of money in business. Doesn't pay you that well sometimes. Yeah.
Nice. So yeah, as in
That's why doctors should all be respected. They put in all the effort, and these politicians take it away from them.
So that's amazing. So that I hope that gives a lot of insight for people who come in newly into this field. So now, just for the fun of it, when I was a little nervous when this conversation started. When I was going to interview a urologist, so I was telling myself, during my science class in 10th grade, my science teacher told, we're going to talk about the reproduction chapter right now. No giggles around. Was that something which you also had in your lectures, or?
So I had that the introduction to that aspect in school. It was put across in a different way for us. They told us that we are going to teach you about the organs, not the act.
Okay, that's clever.
Yeah. So basically that's how it was put to me. Yeah, but we do have these, we do laugh about it when something like a Wiener study comes up in our, in our journal clubs.
Okay.
That's all.
Okay. Yeah. Thanks, Tariq. So yeah, that's nice. We also had a bit of giggles here and there, and like I said, when I was talking to you, you made it very easy for me to have some difficult conversations, at least for me. And you're professional, so you are well versed in that. So I hope you also had fun having this conversation.
Absolutely.
We hope to see you back again sometime in case we are talking about another episode of this. So yeah, thanks everybody for tuning in, and if at all you took up something away from this interview as much as I did, please do subscribe, like, share and subscribe, and we'll see you next week with another episode.